All right. Good evening, everyone. Welcome to Nurse Charms Live. Please share this video with all of your followers. It's going to be a great show tonight. We're changing things up a little bit. This is my political series that I'm starting. I know you guys like, you a nurse, but I've been following politics and I have a strong interest in it. So some of these broadcasts that I'm going to be putting up are going to deal with politics. You know, we what, like less than 70 days away until, November 3rd. So just want to dive deep into the topic and, help educate everyone. So I have my fabulous guest on the screen, Donnell Carter. How you doing?
Good. How are you, Charmaine?
I'm pretty good. Thank you so much for joining me on my show tonight. Really appreciate you, taking the time. It was kind of a short notice too, but thank you.
Oh yeah.
Yeah. So, go ahead and just tell everyone a little bit about yourself.
Sure. Anyways, good evening, everybody, and thanks for being involved tonight. I think we got some good things to talk about. Anyhow, my name is Donnell. I am from Boston, Massachusetts, and currently a practicing nurse anesthesiologist here in Boston. I am also a Navy veteran, served 4.5 years. I am a Desert Storm veteran. I am also an avid nutritionist, and I have a personal interest in health and wellness. So I'm also a personal fitness trainer, and that kind of goes hand in hand with my nursing career, and also how I kind of view a lot of what's going on now, especially related to COVID. So we'll get into that a little bit.
Yeah, of course. That's awesome.
I don't mind if we have a glass of wine while we talk.
Oh my gosh, I'm so jealous. I wish I had some wine. No, I don't mind. I love wine, but I like white wine. Is that red wine you're drinking?
That's red wine, yep.
So, anyway, so why are you interested in politics? I invited you to be a guest because I was on your page and I saw you were saying some things. I know you've been commenting on my page, a couple things I post. So why are you interested into politics?
Well, I've kind of always been interested, over, many, many, many years. I've been involved in the political arm in the nurse anesthesia profession, and also looking, at politics from a macro level too, because of course that affects what happens in your household, and so you have to stay, pretty well knowledgeable and versed on what's going on, because it really can affect things in your pocketbook and your neighborhood and so forth. It's just it's a huge thing.
Yeah, that's so true. And we see the politicization of COVID. And so that's probably one of the reasons why, I just start doing some of my own research and just following what's going on. And, we see both sides pointing the fingers. Everybody's criticizing Trump for how he's handling it, saying that he's mismanaged, this whole thing. But we also look back and see Joe Biden. He wrote an op-ed in the USA Today. It was early on when this thing first started, and basically everything how he was saying how he would have handled it is nothing different from what I read. Is nothing different from what President Trump is doing right now. So I'm like, how can you really criticize one side when you don't even have, you don't even have any better suggestions yourself? Oh, hold on. Let me open up this comment feed. Okay. I want to welcome everybody. You guys can comment. We'll ask your questions. We'll kind of hop back and forth. I'll be talking with my guests, but I just want to make sure that the comment feed was open. You guys can go ahead and ask us anything you like. So I just want to talk about that a little bit. What is your perception of how COVID is being handled right now? What is it that you see could be done better, or what is it that you don't think is working well? Let's just get into that topic a little bit.
Well, the unfortunate issue with COVID is that nobody's seen this thing coming, and it is a virus. It is something that you cannot see. It is something that the world did not even understand, and as they were trying to gain understanding, this thing was catching a foothold across all nations. So not even just the United States of America, but across all countries. So that's a pretty huge thing. The issue was is that because it was so new, it was very poorly understood, and because it was proliferating in a very rapid pace, everything was reactory. You know what I mean? So people were just gathering information and trying things as they went along to see if they could get ahead of this thing that was just, raging on going forward. And so the problem that I see is number one, it is election year.
Right.
And this is a major thing that COVID has crashed the economy, and we're not going to see the repairing of this economy for a long period of time. We haven't seen the worst of it yet, and so I think that, if I was in that position, I would leave it to the experts, because we can't claim to know everything, and so sometimes you have to leave it to the people that do know, the scientists. And the problem is that it's election year, and we have a president right now who I have a problem with because he just doesn't do things the right way. I think he did mismanage this.
Well, you listen to what Dr. Fauci said. Everything they've been telling him to say, he's been doing. And from the top, they were the ones to say at the very beginning, they were the ones to say, don't wear masks. Trump tried to get us to wear masks, and then everybody was saying, oh, that was unconstitutional. So it's just like, well, it's optional. So I feel like everything Trump tried to do, they criticized. And so now it's like, what is the phrase, second day quarterback or whatever it is? It's like, okay, Joe Biden, all of a sudden, oh, you want to put everybody in masks? Remember, Nancy Pelosi was in China saying, oh, this is crazy. It's safe. It's safe to come over here or whatever. And then Joe Biden was calling President Trump a xenophobe, and and saying that he didn't know what he was doing. So, I mean, it's just like all this back and forth. That's why I'm trying to get out of you, like, what else would have been done better besides wear masks?
So the thing is that number one, the politicians need to step out the way on this one. You have to leave it in the hand of the scientists, the healthcare officials, the doctors, to try, and the nurses to try and figure this thing out, so that because the most important aspect of this is the American people, and it's the health of the American people. And without health, you don't have an economy. And until we get ahead of this, you're not going to have an economy, because, as we know, the consumer confidence and consumer index is down right now. And so you see businesses going out of businesses, and they're not coming back. So, this is a healthcare crisis. This is not a political crisis. So they need to step aside. They need to step aside, and whoever can stand up and say, okay, I know I don't understand this, but I'm going to put the man or the woman, and who knows this up front, and let them guide the way, and then I can enact policy decisions and so forth, and recommendation and guidelines that I can hand down to the state, so we can get a better handle on this. But that's not what's happening right now, unfortunately. Once again, it's election year. So, but Trump is the leader. And so as the leader of the country, this falls in your lap. And the problem that I have with Trump is that, the Obama administration, dealt with H1N1 and Ebola. And Obama back in 2015 gave a speech saying that we need to invest in a pandemic plan, which included, having scientists on the ground in China, and so forth, which, fell on deaf ears. And, and he ran a simulation with the Trump administration when he came in. I guess, I don't know, it was like a 12-hour simulation, pandemic drill or what have you, in preparation to prepared an office in the White House, which Trump threw out. He threw out the playbook and so forth. So he really didn't have a plan. And so, boom, it happened. And now we're in this reactionary action plan right now, which is not working.
Well, a lot of it is personal responsibility. Like, I just feel like everyone's pointing a finger, but if people, the science is out there, the research is out there, why are people still getting COVID if they're wearing a mask? You should be wearing a mask. So, I mean, not trying to fault people, but I am faulting people, because if you're showing up at in the emergency room, you're showing up at the hospital, with these symptoms, have you been following the guidelines? Because if you're wearing masks, if you're washing your hands, proper hand hygiene, you really shouldn't get the disease, right? Am I not right?
Well, you have to take right now. There isn't really a treatment out there for this right now. But the only thing that we have is the old school cover your mouth up when you cough, right? Because you have it's a droplet transmitted disease, and so the issue, it's people's personal freedom, and then you have others that are about protecting the public. For me, I wear a mask because I want to protect my mother. I want to protect my father. I want to protect those who are sick in the environment that don't deserve to catch this, who might be immunocompromised and what have you. So as a citizen, as an American citizen, I have an obligation to those people. I can't think about myself at in this moment. I got to think about them, because we know that you can transmit this thing and not even have symptoms, or you can have minimum symptoms and transmit this. And you transmit it to the wrong person, they get it. If they recover good, they might end up in ICU. End up in ICU, most likely you're not going to make it out of the ICU. And so that's an issue.
Right. So what about the whole debate on going back to school? We're starting to see lots of numbers climb for kids, so people are getting worried, but we aren't seeing the numbers climb in deaths. Of course we don't want to see any kids die from this, but I mean, what is your perception? Is it a real concern? I mean, because a lot of these kids are getting it, but they're also recovering. I just feel like the media, they put out all of this, fear, and just like, oh, we're seeing cases climb. Well, yeah, the kids are getting tested, and these kids probably aren't, doing their hand hygiene and wearing their mask. So of course their cases are going to go up. So.
Well, so statistically, those who have the worst outcomes from catching this disease typically are the older generation. They have the worst prognosis from it oftentimes. Those who have, comorbidities, heart disease, diabetes, those who are immunocompromised, those are the people that have the poor prognosis from catching this. The younger generation, the kids and stuff, they for the most part recover from the COVID. But the problem is this, first of all, you get a bunch of kids in the room, one of them has COVID, they spread it to a bunch of kids. And this is where the contact tracing comes into play, right? So those kids go out of that classroom and into the community. They're carrying that disease, and they might go and see their grandmother, and then that child passes the COVID on to the grandmother, and the grandmother ends up in the hospital. So, I mean, it's the domino effect that we're concerned with. So it's a legitimate issue, with these kids going back. And the problem is that, this country has neglected, particularly in the urban area, neglected the schools. And so the infrastructure of the school, like the ventilation systems, are probably not up to date. And so, you got this disease circulating in the environment in these old decrepit schools in the urban area. And we know minorities are disproportionately affected from this disease for many different reasons, but environmentally, that's a problem. So, there's legitimate concern. America has neglected the infrastructure of this country. And so now COVID is exposing all that.
That's very true. Well, why won't they make a deal then? I mean, you got the House and the Senate. They're still, at a stalemate. Nobody is making a deal. Last I heard, it was 105 billion that they want to give to the schools. And, Nancy Pelosi, she came back and they convened about the Postmaster General. She never mention anything about the schools. It's like, do you care about kids or not? Like, why can't they just make a deal on the things that they agree on instead of holding up the entire whole, because it's supposed to be the CARES phase 4. They started out with like, I don't know, what was like $4 trillion at the beginning. And so they've been doing, these additional bills to pass, more money. So they still have money left over. And so that's how they're going to pass this bill that they're currently working on, but they haven't been able to. So, I mean, what is your opinion on that? Yes, you're right. The schools do need the infrastructure, and there's money available. Well, it's a holdup, So what do you do? Well, it's like they want to just lock down the country, keep the kids at home. If you keep the kids at home, the parents can't work. Who's gonna, daycare?
Once again, like I said, COVID has made an honest person of us all. It has exposed every deficiency, every ill in this country that has been neglected for a long period of time. And so, like I said, we are not proactive right now. We are reactive to what's going on. Unfortunately, this thing is a million miles down the road, and we're trying to catch up to it. And so, again, it's political, it's election year, so they're playing political football, and, the people that are suffering is the American people, and I think, I would hope that whoever gets in office next, would, begin to make infrastructure a priority, and work from there.
Yeah, let me catch up on some of these comments over here. Trevor says using the federal agencies to obtain PPE would have been ideal rather than having individual states doing it and thus bidding each other up instead of the individual states bidding each other up. There should have been one bidder, the federal government, thus the PPE could have been acquired and distributed at a better price and in a more timely manner. Yep, that's true. And I don't have an issue with private companies. We were at the mercy of China, and the 3M, they supply all this mask, and now they're Trump is trying to keep all of the manufacturing over here. So we don't have those issues. Matter of fact, in Michigan, they turned one of the plants into making ventilators and PPE and all those things. And I mean, I think that's good, removing some of the regulations and letting some of these private companies make this equipment. And I think the Democrats, I don't think they like that idea, keeping it private. But we shouldn't be giving all of our money, and we shouldn't be at the mercy of China and all these foreign countries for our business. I don't agree with that. But
what I can say about Biden is that he is talking about actually making that stuff here in America where it should be made. And like I said, this pandemic is going to make us look at things a little bit differently going forward.
Trevor, he just says each person has the responsibility to take care of themselves. He says, I could be wrong, but wearing a mask and distancing isn't as much about protecting yourself as it is about transmitting it to others. It's both. It's equally, but you wear a mask to protect yourself from others. She says, right, there's no treatment plan, plus people are traveling in. Oh yeah, that is true. People are still traveling. I feel like they should have made a travel ban within the states, but I know people didn't want that because they threw that out there, and it was like a huge uproar, because people were like, well, they need to be able to go see their families, and you can't put a travel ban on going state to state. So they just made it, out of the country. Trevor says the kids may recover, but who are they bringing it home to? Yeah, we talked about this. And are those people going to be able to recover from it? The cases are spiking first, and the death rate will probably lag behind. People don't die immediately. It takes time, sometimes lengthy battles. That's true, but we aren't seeing a lot of kids die from this. Oops, hold on. Dennis says big corporations, pharmaceuticals profited $900 from the coronavirus pandemic. Why would this small group want a cure when it rarely affects rich people? You want to answer to that?
Yes, I mean, it's a very good question. It's a very, it's a very valid statement. But, they, pharmaceuticals and these corporations are, the ones that are in charge of making the virus. I mean, the first one to bring it to market, and provided that the safety, it passes the safety muster, it brings it to the market, stands to make a lot more money. So there is an incentive to get, a safe vaccine out there, because it's just not like it's not just affecting the United States of America. This is a global pandemic. So yeah, they're going to make money, but for those who believe in, in getting back, getting the vaccine and its effectiveness, then it's probably not going to be a big deal for them, as long as they're safe and they can go visit their grandmother and grandfather and mothers and fathers and stuff. So,
classroom teachers have the biggest risk. You believe that?
I think healthcare workers have the biggest risk. If you ask me, every day I go into work, man, I got to wear a mask, man, every single day, every hour of the day, and every time I look at a patient, I am sitting there wondering where you been. So teachers do have, they're at risk too. I mean, everybody's at risk. I mean, people that drive the trains and the buses and the grocery people, everybody's at risk, and so, but yeah, teachers are definitely at risk, especially being around kids in a very close setting, and in decrepit buildings that haven't been kept up and updated.
Do you mind sharing? Have you been exposed to the virus, or you haven't been tested, or you don't know, or?
I have not been tested. I've been meaning to go get an antibody test, but I haven't done that yet. But I did have one scare a couple of months ago where one of my coworkers caught it, and I happened to be in the same room with this person. And so at that point, I didn't get tested, but they said if you begin to show symptoms, then you come in
Right.
and get tested. So yeah.
So this the CDC, they updated their guidelines. I don't know if you saw that on their website or not. I posted on my page. They're basically saying, you saw it. They're basically saying that you shouldn't be getting tested. Like, everybody's just mass testing, all willy-nilly. And they're like, you shouldn't be getting tested if you you shouldn't be getting tested if you don't have any symptoms. Now, I have believed that from the very start. As a nurse, that was my whole thought press. Like, why would you get tested if you don't have any symptoms? It really doesn't make any sense. And then also the fact that you can get it again. Okay, so I get tested. Okay, it's 8:22. I get tested, and then 10:30, I could be exposed to someone else. You know what I'm saying? So that was the part that was just so silly to me, when they were just all this mass testing. Now, I do understand testing the vulnerable. You know what I'm saying? Because you want to isolate those people, especially the ones who have the comorbidities and all those stuff, because you want to try to get them earlier treatment. But so I do agree with them updating them. And then CNN is putting out fake news. They're saying that Trump pressured the CDC director, and I don't believe that. I haven't heard him say anything. He basically says that it's no research, and that's why they updated the guidelines. It's not because we're running out of tests, or whatever reason that people coming up with conspiracies. And then also they said that they updated the guidelines. Now, this one, I kind of still got a side eye to it. They said that if you've been exposed to somebody within the first 15 minutes, then you don't need to get tested unless you have any symptoms. So what are your thoughts on that updated guideline? Because I always thought it was, you find out you were exposed to somebody with COVID, you go get tested. But they're saying that don't go get tested unless you actually have some symptoms. So what are your thoughts on that?
They're just like with the flu or the common cold, there is an incubation period. So, if you've been exposed within 15 minutes, the likelihood of you testing positive is probably, pretty small. And so, there is a period of inoculation where the virus replicates in your system. And then as the virus replicates in the system, when it gets high enough, that's when you begin to exhibit the symptoms. And so that's when you get tested, and, you're likely, there'll be a higher chance of testing positive at that time. But within 15 minutes, absolutely not. It's going to
So
take.
you agree with it? You agree with it?
Yeah, I agree with it because that's kind of how viruses. I took immunology and I studied immunology too as a nurse anesthetist, and so I have a pretty good understanding of viruses, how they work, how vaccines work, and so forth. And so there's a period of time before it actually starts to pick up and show symptoms in your system. So I can agree with that. 15 minutes is not it's too soon.
All right. Bridget says Trump is not doing anything but blowing smoke. What company has returned from overseas? Where are you referring to, Bridget? If you're still on here, clarify that a little bit. Let's see. Dennis says politicians of both parties are using the coronavirus pandemic as a political football to score points to win. Yeah, they are. Yep.
They are, but like I said, you're the man in charge. This falls in your lap, and how you handle this, you're in the spotlight. And I would say the majority of us do not agree with how he handled it, and it could have been handled a lot better. In fact, he could have been a lot more proactive when it came to.
So here's the thing, that the Democrats keep calling for a nationwide plan. Why do you need a nationwide plan? The governors are responsible for governing their state and managing it. They close down what they want to close down, and they manage it. Why do you need a nationwide plan? Because some states may not be as impacted as other states. You know what I'm saying? So why would you do a nationwide? And then there was a nationwide plan. They put out, what was it? I forget, but they did. Pence was over it. I forget what the plan was actually called, but I know they had the plan, the stages in order to the reopening. It was the reopening plan. That's what it was. So what more of a plan do you want?
I think in my opinion, I think there could have been much better leadership from the federal level and much better coordination between the federal level and the state level. And the reason why I say it is, I think so because right now that didn't even fall in line, i.e., Florida and Texas, and now their numbers are approaching New York's level. They're at over 600,000. They're going to surpass New York City. Probably even the next couple of weeks. And so there needed to be, a stronger voice, of reason, and like I said, the presidency is that's the bully pulpit, and a lot of, the Republican governors, except for my governor who, who's handled this quite well. And he's a Republican. He said, I'm in Massachusetts. And my governor's Governor Baker. He's done a great job in terms of managing this because he put science first. But the thing with Governor Baker is that he was head of one of our health plans, or one of our health plans, Harvard Health Plan here in the state. So he understands the science. He understands how important that was. So, in terms of Trump, he needed to have a strong voice, and he needed to put everybody in line and say, okay, boom, let's talk about this thing and see, and figure out what we need and what we can do. But that's not what he did. And unfortunately, we were strong in some states, and, we fell off in some states, and, Florida and Texas are one of those two states, and their numbers, they were low. They were very low. They're up in the 600,000s now, and they never shut down.
What are their recoveries, though? What are their recoveries? What are their recoveries?
I don't know those statistics, to be honest with you. But like I said, they're an example of people who did not do a thing, and their numbers went through the roof. So in terms of a national plan, I don't know what that looks like, but I know it should have been a stronger national plan that should have disseminated down to the governors, and the governors back up to the national plan. It just should have been better coordinated, and I would have had a better effect on for the American people.
I don't know. I feel like that's just a way to point the finger, because the Mike Pence, he was the one talking with the governors. They had the coronavirus task force. They were doing the press briefings every day, daily. I would watch them faithfully because I wasn't working or doing anything. So, I mean, I've been following this. And so now, you know, as it gets close to election, it's like, oh, Trump didn't do anything. He mishandled it. It should have been a national strategy. We should have been had a mass mandate. And it's like all of this stuff, it's already been done. But let me see. Let me go over here to the comment feed. Somebody says, could getting a flu shot help prevent you from getting COVID? No, it's two different viruses. And to be honest, this is just my opinion. I normally get a flu shot every year, but I don't think I would get a flu shot this year because in the hospital, if you don't take a flu shot, you wear a mask. So we're all in masks. So why would I get a flu shot if we're going to be wearing masks? And to really be honest, I haven't had a cold or nothing. It's like I almost love, I hate wearing masks, but I almost love it because I feel like it's just protecting me from everything. So what is your advice? I'm in Michigan. Our governor is here is telling us to take flu shots, but I don't, unless we're like, you know, once again vulnerable, I really don't see why a healthy person would get a flu shot if we're in masks. But what's your viewpoint on that?
Well, you know, I think you know, for me, I differ on that. I probably will get the flu shot because I've gotten it every single year. Yeah, because I work in a hospital, and I mean, you know, but the thing is that we know that, you know, we have flu season coming up, and we also know that, you know, and we predict that we're going to have another surge in the fall too. So now you're approaching flu season, and you got a predicted surge in the fall coming up, not, you know, in the next month or two. So, I mean, that's a double win right there. Now, I don't know. Imagine catching the flu and catching COVID at the same time.
How would I get the flu if I'm in a mask?
Well, no, if you're in a mask, I mean, no, you're right. If you're in a mask, then you know, you should be good. But once again, when you're outside of the hospital, well, I guess you're in the, you know, if you're wearing it in the environment, then you're good. You should be straight, provided that you got the right mask.
Right.
You know, if you got the right mask, because we know we wear scarves and head scarves and things like that around our faces, which is not necessarily protecting us.
I was getting a takeout from somewhere. I was so furious. I went to say something to him, but you know, they fighting people nowadays. I'm not about to get involved. This guy had a freaking napkin. I mean, he just was just basically being so defiant and just, you know what I'm saying, honorary. He just had a freaking napkin. Here, I got a napkin here. He got a napkin over his mouth like this. Oh yeah, really? Like that's really, you know, like just don't even come in the store. Like I wanted to say something like, why are you guys allowing him? Like, come on, people need to have a face cover. You can't just have a mask up like, I mean, a napkin up like this. Like, right. Come on now. Let's see. Cheryl, she says, I didn't get one either. I usually do. Yeah. I mean, that's just my advice. I mean, maybe I should just keep that advice for myself, even though I'm a nurse. I'm not going to say that I'm putting that out for everybody else. You guys make your own decisions. But me personally, I won't be taking a flu shot. I mean, if I'm in a mask, because that's what we do at the hospital. People at the hospital, employees at the hospital, I'm sure they do that at your hospital too, right? Because you know, you got some people like, I ain't taking no flu shot, and because you know, I was in leadership and management, so we would be like, okay, you don't want to take flu shot, you got to wear a mask. So we made sure those employees had on masks. So I don't know, but that's just my opinion. One thing I want to get into real quick before we go. Oh my gosh, time just flew by. Yeah, but this is great. I'm really enjoying this. So you know, this is more to do with politics. So you know how they're spending all this money on, you know, food stamps, you know, Section 8, you know, just government assistance in general. Why not use that money instead, you know, to help people get education, you know, so they can get a better paying job, or you know, just something else. I just feel like that keep giving people this assistance is just going to always keep them in poverty. How is that going to help them in the long run?
I 100% agree with that. You know, this is where I kind of shift a little right. Now, where I sit on the political spectrum is typically left of our center, but I can shift right on some issues, but with empathy at the same time. So that being said, in regards to these social programs, I do think, I think they should be there, but I don't think they should be people's careers. Basically, you're on it for a lifetime, and I don't, and it's just my opinion. Others may feel differently and may disagree with this, but I feel that they should be there for those who really need it, and those who really need it. If you of sound body, mind, and soul, and able to work, you use it to get you to your next level, so that you can get off the assistance and then move on and continue to progress in life. A very good example of this is my mother, for instance. Mother, I grew up in a single parenting home. She raised 3 kids. She took assistance one time. She says, I didn't like it. I felt like it had a stigma, stigmatism, to a stigma related to it. And she says, I got right off of it. And, she ended up working 2 or 3 jobs, and then went to school. It took about 10 years to get a bachelor's degree, but she did that.
Wow.
That's fine. There were times we had clothes donated. There were times when, the lights got shut off or what have you. But, it was, she thugged it out. She roughed it through, and she made it through. And we all made it out just fine. And so I agree. There's this guy called John Hope Bryant that I really idolize, and he has a really interesting philosophy. If you ever get a chance to look him up, he talks about civil rights, but he also talks about silver rights. And his thing is, he has this big nonprofit where he is directed to lower income people to help them get their credit in check, to help them, understand the entrepreneurial spirit, capitalism, and how you can harness capitalism to your benefit. If we can do that, then you can progress and get off these programs. So, okay. So here's my thing with Trump. Can I say this real quick? If I'm wrong with it, let me know.
No, go ahead.
I don't mind a businessman being in that position, and this is the reason why.
Me too.
I do not mind. I just think he's the wrong businessman for the job. But I do not mind a businessman being in that position. The reason why is this. All right, and when we talk about Black economics and things like that, I think we'd be better served if we had a businessman who understands the role entrepreneurship plays in lifting people out of poverty. And so if you're guided by that principle and that value, it may guide your policies and to create programs that help these young kids in these neighborhoods understand capitalism, understand entrepreneurship, and how they can make a life for themselves, even if you don't even want to go to school, because college is not for everybody.
Right.
But, it doesn't mean that those people are broke. In fact, the richest people in the world didn't even go to college.
Right.
If we had somebody in place that could, create that kind of program, I think, we get more bang for our buck and better return on our investment, as an American people and taxpayer.
Yeah, and that's why I bring it up, because I'm an entrepreneur. I've been an entrepreneur for 8 years. I've been a registered nurse for 18 years and an entrepreneur for 8 years. So I'm definitely pro entrepreneur. So that's why I can't appreciate some of Trump's policies. But when you look at Biden talking about, he wants to immigration on day one. He wants to focus on DACA. And I'm like, here we are. They've done so many cuts in the schools. They don't even have the same program. When I went to school, we had home ec, you know what I'm saying? We had all of this stuff, language. They don't even have computers. They don't even have any of that stuff anymore. So why are we putting money into DACA and immigration, and our own school systems are suffering? So that really doesn't make sense to me. So that's another reason why I can't support his his policy on that, and because again, just we could use instead of using money for immigration, use money for these programs, and like you said, people don't have to go to school, college. College isn't for everybody. I love college, but you can still go to trade schools and you can teach people about, their credit, help them repair their credit. There's so many different skills we can put money, invest into our own Americans and help them become better so they can, that's almost everybody's dream. A lot of people want to do an entrepreneur. I know a lot of people don't, as well, but for the most part, people would love to run their own business. So give them the skills so they can run their own business.
I agree with you. The problem is that we elect the same people over and over and over again. I'm of the thought that we need to gut the whole entire Congress, get all those old codgers out there and put some young folks up in there with new ideas that are innovative, that have energy, that can think on the fly. We have people in there that are thinking in the past. You can't have leadership that thinks in the past, because if you do that, then we can't move forward. So as long as we recycling these same politicians over and over again, guess what? We're going to just kind of slug it out. But you have places like China who are, they're outpacing us big time, at the moment.
Right.
We're stuck in the past. We're still fighting old issues right now. And we shouldn't be, we should be looking forward as a nation, as Americans, and saying, okay, how can we outpace, how can we outcompete the world right now? But we're so stuck in our old issues right now because we're led by the wrong people. So we need some young folks in there right now. We need a younger president, with new ideas that can think, think innovatively.
Right.
When it comes to, issue running this nation.
Okay, so what's your last final thought you want to tell people, just about this whole election season, and, motivate them to vote, or why they should vote for one candidate or the other, just whatever you want your last words to be.
Yeah. Right now we have a crisis, we can't ignore the crisis. And our crisis is the COVID pandemic, and as a result of the COVID pandemic, our economy is suffering, and it's going to continue to suffer as long as this thing is present and taking its foothold. For me, I don't think we had the proper leadership on this right now, and so we need somebody else that does not mind stepping back from the spotlight and allowing the experts to take the lead on this one right here, because that's who needs to be up front. And so, for me, Trump ain't it. He's just not it right now. I don't know what Biden's going to bring to the table, but I already know what Trump brought to the table. And it doesn't taste good. I know what he brought to the table over the last 3.5 years, and it doesn't taste good. And this is one last thing, and this is totally off that. In terms of this virus, and I want to say this, is that we have to put health and wellness first, especially in the Black community. All right, we are disproportionately affected by this for many different reasons, for all the reasons that you've read in the media. But the one thing that's not really spoken about is our lack of respect for our bodies, and and what we put in it, and not exercising. And and this is another thing that exposed, we have a very high rate of comorbidities in the Black community, and that's why we're suffering the most from it, amongst other things. But that is the most controllable factor that we have right now, without begging people to do anything about healthcare. Our immune system, our hearts, our lungs can be handled right here in your home. All right. If you take care of it right here in your home, all right, then you'll get more bang for your buck, and you'll get better traction and get on it. So, I do see a lot more people out on the road right now. I'd love to see the whole entire community out on the road, going out, walking, exercising, and understand how food plays a major role in this right here. And then you may not even have to go into the healthcare system because you're so healthy. And like I said, my mother, being that the other thing is she's always exercised too for her entire life. She's 17 years old. She still gets out there on the road. She's not on blood pressure medication. She's not a diabetic. She's a healthy. She's not on any pills at all. So, let's take health and let's make a priority for, on health and wellness, and get ahead of that too. And that's the American thing too, because that'll save us some money if we're healthier.
That's awesome. Listen, you heard it live. You heard it first. Donnell Carter telling y'all to stay healthy. It's your personal responsibility. Prevention. Thank you so much for joining me. You have been so awesome. Thank you, everybody on the comment feed tonight. You guys have been amazing. Asked some good questions and some great engagement. I'm gonna have to invite you back. Like, this was so much fun, and you are a wealth of knowledge. So
We talked about so many other things too. So yeah.
I know. Just just limited time, because I mean, let me just be transparent. I want to watch the RNC tonight. So
Okay.
that's already started. I gotta take my notes off of that. But yeah, I'm gonna have you back for sure, and we'll talk more on this. Thank you so much. Thank you, everybody, and that's it. That's a wrap.
Thank you, everybody. Peace out.
Good night.
Yes.